You've worked your whole life, but here's a reality check. Medicare doesn't start until 65. So what happens if you retire at 60 or 62? For millions, those in-between years can turn into a financial minefield. But with the right plan, you can protect your health and your savings long before Medicare kicks in. So, why is planning before 65 so crucial? It really comes down to protecting your nest egg. Without employer coverage, premiums for someone in their early 60s can be steep, often 4 times higher than what you'd pay for Medicare. And it's not just about money, it's about timing. If you go without coverage for just 63 days, you could face lifetime penalties on your future Medicare premiums. Plus, retirement doesn't always happen on your schedule. Did you know that about 31% of workers retire earlier than planned due to health issues? To navigate this, you need to understand what you're aiming for. Medicare. Think of it as the finish line at age 65. It's made up of parts. You have Part A for hospital stays, which is usually premium-free. Then there's Part B for doctor visits, which has a standard monthly premium around $203 for 2026. Part D covers your prescriptions. Alternatively, some people bundle these into Part C, or Medicare Advantage. The most important thing to remember, your enrollment window. It opens 3 months before your 65th birthday. Mark that date because missing it can be a costly mistake. Now let's talk about crossing that gap to the Medicare finish line. If you retire early, you have 4 main bridges. First is COBRA, which lets you keep your employer plan for 18 months. You keep your doctors, but it's expensive. Often $800 or more per month because you pay the full premium plus a fee. Second is joining a spouse's plan if they're still working. Third, check for retiree health benefits, though only about 17% of large employers still offer them. Finally, there are marketplace plans. This used to be a major savings tool, but it's a different world in 2026. The enhanced subsidies that kept costs low have expired, and average premiums are projected to more than double for those in their 60s. However, if you manage your income carefully, you may still qualify for some federal aid. Pro tip: if you have an HSA, you can use those tax-free funds to pay COBRA premiums. It's the best way to soften the blow of those high costs. Let's talk numbers because sticker shock is real. In that gap phase before 65, a full-price silver plan could cost you $12,000 to $14,000 a year. Without the extra credits we saw in previous years, middle-income retirees need to budget significantly more for monthly premiums. Don't forget deductibles and dental or vision care, which most plans stop covering once you leave your job. Once you hit 65, costs usually go down, but Medicare isn't free. With the $202.90 Part B premium, plus a supplement and drug plan, a typical retiree should budget roughly $390 to $410 a month per person for comprehensive coverage. View this like a monthly utility bill, essential and manageable, but only if you plan for the 2026 rates. To see how this works in the real world, let's look at Jack and Linda. Jack is retiring at 62 and Linda is 60. Their employer coverage is ending and they are 3 years away from Medicare. They need a bridge. They looked at COBRA, which was pricey at $1,500 a month, and the marketplace, which rose to $800 a month after the 2026 subsidy changes. They chose a hybrid approach. For the first 6 months, they used COBRA so Linda could finish a scheduled surgery with her current specialist. They used their $10,000 HSA to pay those premiums tax-free. Once the surgery was done, they switched to the marketplace and carefully managed their income to stay below the subsidy cliff. When Jack turns 65, he will move to Medicare. He'll benefit from the new $2,100 out-of-pocket cap on prescription drugs, a huge 2026 win that protects him from skyrocketing pharmacy bills. Retirement should be a celebration, not a time to worry about medical bills. As we've seen, the secret is simply taking charge early. So here is your action plan. Start mapping this out in your late 50s. Connect with your benefits office to see what's available when you leave. Get quotes from the marketplace so you aren't guessing at the numbers. And please don't hesitate to reach out to a professional, whether it's a retirement planner or a Medicare specialist. You've worked hard to earn this time. With a solid healthcare plan in your back pocket, you can focus on what really matters. Living your retirement dreams with confidence. You've got this. That covers our essential moves for today. If you found this video helpful, please give it a like and tap the bell for alerts to keep these practical insights coming your way. And if you haven't already, subscribe to the channel by clicking right here. Thanks for watching.